Hello, and welcome to the Shared Value Initiative Speaker Series. I'm Bobby Silton, Managing Director of the Shared Value Initiative. We're a global platform for leaders seeking to address societal challenges with business solutions. We're a part of FSG, which is a not-for-profit social impact consulting firm. Today, our speaker series is focused on an important topic of improving access and addressing equity in health. We believe without equity in health access, it is challenging to have an equitable society. Half of the world's population lacks access to essential health services, and the COVID-19 pandemic has brought those disparities in health into sharp focus. But these challenges aren't new. They've been documented for decades and reflect long-standing access challenges and inequities we struggle to address. Today, we're going to hear from two healthcare industry leaders whose companies are working to deeply understand these challenges and inequities and using that understanding to develop innovative and more effective solutions. We believe their insights and lessons learned on advancing equity and access have value for any corporate leader seeking to drive more equitable outcomes. Before I introduce our speakers today, I want to just take a moment and thank our generous sponsors: Discovery, Jenelle, Merck, Truist, Walmart, Abbott, and Sanofi. I want to thank all of these companies for their generous support of the Shared Value Initiative and this speaker series. Their contributions make this series free to the public, so thank you to all of them. Now let me introduce our speakers for today. Adam Gluck, Senior Vice President and Head of U.S. and Specialty Care Corporate Affairs of Sanofi. We have Jenelle Krishnamoorthy, VP and Head of Global Public Policy and International Affairs at Merck. And they're going to be in conversation with Dr. Lauren Smith, Chief Health Equity and Strategy Officer of the CDC Foundation and board member of FSG. Before I hand it over to Lauren, I just want all of you in the audience to know we're going to have some time for audience Q&A today. So please use the Q&A function if you want to ask a question. So Lauren, I'm going to hand it over to you and I'll be back to close the session.
Wonderful. Thank you, Bobby. And thank you for the opportunity to be in conversation with these two very impressive and insightful leaders. So good morning, Jenelle and Adam. We want to dive right in because we don't have all that much time and there's so many things that we want to sort of get into with you. I guess the first thing I'd love to ask both of you is to share a little bit of how your past experiences have gotten you where you are in terms of your current thinking about equity and especially access to health. So why don't we start there?
Jenelle, you want to kick us off?
Okay, Adam. I'll just say thank you for the invitation, and this is just a pleasure to be on this panel. And Adam and I, because of this shared interest, have worked together for a long time in the past and have been a bit partners in crime and really striving to ensure access and equitable access around the world. I will say for me, it's very personal. My dad came from India, and I quickly, as a first-generation American, quickly saw how complex our health system is. And when my grandparents were coming here, how do you navigate it? And how do you give a voice to people that don't have a voice and aren't at that table and aren't in the rooms? And so I've been very fortunate with my education, my career. I was at those tables and I worked for people like Senator Harkin, like Merck, when I was at the State Department, where I had the ability and the privilege to think about things from a 360 view and how are the policies that we're engaging in going to affect individuals that don't have a voice at that table. And that is something I always look to and strive to do as I am working on health policy.
Yeah, so so first, it's a pleasure to join all of you, and Lauren, nice to see you, and Jenelle, as she already said, we go way back, so it's always nice to see her. I think my kind of journey has some similarities to Jenelle's, but also some differences. You know, I started learning about the challenges of equity and inclusion and health equity in particular when I was growing up. I grew up where I grew up in Flint, Michigan, I was a minority, and learned very early the differences between many of my friends and myself, just based on factors that were totally beyond their control, and social determinants of health and related issues. And I'll come back to some of that probably as we continue the conversation. But professionally, my career has, I think I've learned every step of the way, in each one of those learnings, and the people that I've had the privilege and honor to work with and for have helped educate me about the challenges and barriers to health equity. So whether it was on Capitol Hill, where I worked for a member of Congress who represented a majority Hispanic district, or as Jenelle mentioned, Senator Tom Harkin, who was a champion for those who didn't have as loud a voice as some others, or at the Children's Defense Fund. I've had the great honor of working with and for people who've dedicated their careers to health equity and equity even beyond health, and taught me a lot of what it means to be an ally and a champion for those who haven't had some of the privileges I've had. Beyond some of that, I've worked a lot with the patient advocacy community and disability groups, which I think helps kind of ground some of our conversation today. And I've, through all of it, and even in industry now, I've seen the challenges of equitable access creating a disconnect between the treatments that companies like Merck and Sanofi create, and then access to those treatments to really deliver on the promise of medicine and science for patients. So it's something I'm very passionate about and thrilled to have this conversation today.
Well, I'm intrigued that both of you, went to sort of your own experiences sort of growing up. And I think it's interesting to point out that the kinds of exposures and experiences that you have such a lasting impact on you. I'm wondering if we could start by sort of setting a clear sort of understanding of what it is that we're actually talking about. And I'd love for you all to get into this distinction, as we talked about before, around between healthcare and health, because this conversation, really started off, I think, initially as, well, let's talk about healthcare, but you broadened it and wanted to talk about, like, no, we really need to be talking about what is access to equity in health. And so how do you two make that distinction between healthcare and health as members of organizations that are obviously in the healthcare ecosystem?
Yeah, so maybe I'll go first this time. I think they are two sides of the same coin, but they are very different. While the word health is in both phrases, they're different issues. So the way I think about, and the way we think about healthcare, it's more about services, it's more about coverage, it's about the ability to obtain healthcare services, the ability to afford healthcare services. And when I think about health more broadly, it's about having the ability to really go beyond the health itself to achieve your full potential, regardless of your circumstances or social status. And to me, this is where, I mentioned this before, but this is where social determinants of health really come into play and become a driving factor and determinant in somebody's healthcare and in somebody's health, and then ultimately the life that they live. Studies show that medical care, healthcare, only accounts for about 20% of a person's health outcome. And that the remaining 80% can be traced to things like housing, food access, transportation, education, socioeconomic status, probably health systems beyond healthcare. And so without addressing health and healthcare holistically and together, we just don't believe, and I don't believe, that we'll truly achieve an equitable society.
Maybe I'll just add on to that, which I think you have my talking points, Adam.
We have worked together before, so.
No, it totally aligned. And so, bridging off of what Adam said, I think it is very much health in all policies. And so this then goes back to what we were talking about in your first question is, when you're on school boards, when you're on transportation issues, when you're thinking about, and the first step, which it's so hard to do because many times we fail, in the pharmaceutical and device and, business, when you're looking for medicines and vaccines, that you finally come up with that jewel that works. That's honestly the first part. And even before then, you have to think about where is this jewel going to go? How does it get there? What partners do we need? Because if we're looking at health in all policies, and as Adam said, with the social determinants of health, looking at education, transportation, housing, that means we have to do an end-to-end system. And that's going to take a lot of people being invested. So that's how I agree with everything Adam said. Think about when we are looking at how, we are going to make an impact on health, and health care in the system is part of that. Population health, that means we need to think about everyone that has to do this together. No one's doing it alone. So those are some of my thoughts.
Well, I wanted to just pull on the threads. You both sort of dangled some threads, and I can't help but pull on them. But what are can you all give some examples of the kinds of barriers to health that you all are talking about? Because I think sometimes people feel like, well, gosh, if people have health insurance, they should have health. And clearly you all are saying that that's not the case. But what are some examples of the barriers outside the healthcare system that you all are thinking about?
Well, so number one, I think if you have health insurance, you should have access to healthcare. I don't believe that that's currently the state of our healthcare system, and probably hasn't been, I'm not sure ever, but it's certainly been, in my opinion, a kind of a deteriorating system that's no longer working in the best interest of patients. And that's probably a whole nother seminar and discussion that we could dive into. But I think before we started, Bobby had mentioned that folks from over 50 countries had signed up for this discussion, and so I think it's important to acknowledge that every country and every health system has its own challenges. So we're not talking about a one-size-fits-all solution here. But I think the reason health is such a core issue and such a topic of importance to so many different folks, like Jenelle said, if it's a policy discussion around transportation or housing, or it almost doesn't matter what the topic is. Health has to be a part of that conversation, because if you're sick or unwell, you can't work, you can't support your family, you can't care for your children or other loved ones. It's isolating. And so, as a global company, we really think about health as a multidisciplinary approach that requires different types of investments, different types of strategies based on the place that we're trying to make the impact. And so, it's really focused on understanding the local needs, addressing local challenges, and then designing and co-creating with local partners solutions that meet them where they are. And really, it's founded in listening and understanding. I say this a lot with my team, but the problem we're trying to solve, and they're not assuming that we have the answers, but really engaging at a local level to understand where the access barrier is. And for some, it may be an insurance coverage issue. For others, it may be a benefit design issue. For others, it's going to be a lack of insurance or a lack of access to providers, or health literacy challenges. So there's not one solution, and I think that's where it requires a level of commitment and determination to really understand the different challenges, plural, and then designing solutions that solve for those specific challenges.
And maybe I can just add to that. So I could say, like with Ebola, here we came up with a vaccine, but then we had a disorganized environment full of conflict. How can you get that vaccine into the people? Here we have COVID-19 vaccine. And we have vaccine confidence issues and hesitancy. That's now not just with COVID-19, but the misinformation that is going there with just even our routine vaccinations. And how, again, as Adam was saying, okay, we need to, I know we just did a partnership with Meta and other social media, because we're finding, putting journal articles in the American Medical Association and such, that's not going to deal with the misinformation. We need to get to the social media, and that is where other partners are definitely the ones to work on. And so I think, you know, as Adam referred to, we definitely don't have all the answers. And in these different environments, you know, maybe it's faith-based leaders that are the best individuals to be building trust on, you know, educating. And I think that is where, you know, you have to take a unique approach, and you need to take that unique approach early, because a lot of this groundwork needs to be addressed early and be as strategic. So if there is a medicine or a vaccine that can help, the environment is ready to receive it.
Right, right. And one thing that I'm hearing you both say, and before we switch gears, I wanted to give you an opportunity, if there's any more you wanted to sort of go down that road, was around how foundational health is to overall well-being. And Adam, I heard you talk about economic well-being, educational well-being, sort of, and that's relevant globally. Can you spend a little bit more about that aspect of why health is so why you feel like equity in health is so foundational to equity in these other spheres?
Sure. Yeah. I mean, listen, health is among the most personal things in our lives. And, you know, my family has had some experience where one of our kids was sick and had a lot of issues and challenges from a health perspective for the past couple of years. And it becomes all consuming. You don't have another choice but to focus on that challenge. It's disruptive to work. It's disruptive to other parts of the family. It's you know, and if you don't have a safety net of friends, family, resource, income, a job where that gives you time off to care for somebody, you know, these are things, you know, I'm fortunate and privileged enough to take some of these for granted. I think taking for granted is probably the wrong phrase, because I don't take them for granted. But I'm acutely aware that not everybody has them. And one of my experiences and learnings through the journey that we've been on is just appreciating how many are going through, and maybe not exactly the same as we went through, but every family has their health challenges. Whether it's a parent, whether it's a child, whether it's themselves or a spouse or a sibling, you know, people get sick. And so it is so foundational to everything that we do, and the ripple effects that it touches go everywhere. And there may be other examples of that in our lives. I can't think of any off the top of my head, honestly, Lauren. And so to me, the reason it's such a core issue is because it's at the center of our well-being, of our ability to do all of the things in our lives that we want to do, and to kind of live our best, healthiest lives requires access to healthcare and health equity that you know isn't available broadly right now, probably in any country.
Yeah. Well, why don't we pivot a little bit? And I wanted to give you ask you a little bit about how Merck and Sanofi are thinking about or how you all are using guiding frameworks or principles to be able to scaffold your work in this area, because it can be, for those who might be listening who maybe don't have them, it can be a little bit daunting to figure out how you're going to sort of enter into that work, and how do you try to dig into something that's such a big topic or big area, as you all both have been just talking about. So how have you all gone forward in making something manageable and not being overwhelmed by the size of the task?
Maybe I'll start. I think, you know, one of Merck's guiding principles on this was that it had to be enterprise-wide, that this could not be marginalized in like corporate social responsibility, and that you're in charge of that, go forth, come up with frameworks. Instead, we needed to be thinking about this in medical research laboratories and MRL. So as you're doing phase 1, phase 2 research, you're thinking about where's that unmet medical need? How do we need to form our clinical trials? Where are we doing these clinical trials? Then what access programs do we need to be occurring throughout the continuum? And so it is something that also business development and, throughout our, in addition to policies and that HR, how we're doing our engagement with suppliers and who are we working with, and the diversity and inclusion in there. So I think, our guiding principle throughout our health equity framework is that it needs to be embedded in everything we do and be part of our business strategy. And that is just a core principle. We have that on our scorecards. We have to all be doing the health equity and showing our part. So I think that is something that is really important, and that we do have experts, Lauren, that does the digging in as you're talking about, but then it's a partnership across the enterprise to ensure it's uniquely structured, so it's really going to make the biggest impact on that specific business unit or function.
And Adam, before I get to you, I want to just ask Jenelle a quick follow-up. You were so adamant the way you described it. It had to be enterprise-wide and not marginalized. What's the drawback, or what have you seen not work with it, quote, being marginalized in the way that you were describing it? Why were you so adamant about that?
Because there needs to be accountability. And if each of the business leaders that are on the executive team that have to go in front of the board, if they think it's not my thing, I don't have to do that, it's so-and-so's, and it's only one person that has to, no, there needs to be accountability from your board of directors, your CEO, that this is across your enterprise, and that it's not just something nice to do, you have to do it.
Okay, Adam, I saw you nodding.
Yeah, no, I think this time she stole my talking point. So we'll see how this goes. But I think to go back to your kind of core question, Lauren, like, how did we do this? I think the answer is slowly, methodically. We have several guiding principles that have kind of shepherded us through this journey, which is not completed. I don't think we'll ever get to the destination. It is a continuous learning and a continuous renewed commitment. It starts with listening and talking to our stakeholders. I think I touched on this earlier, but we recognize that we have ambitions to do lots of things. Fortunate to work in a large global company with thousands of brilliant people from all types of different backgrounds that bring expertise and knowledge to bear. That doesn't mean we know how to do everything. And we need to listen with humility and authenticity to make sure that we understand the challenges that others are experiencing if we're committed to solving them. I'll kind of echo one of Jenelle's points, which is it's not a nice to have, it's a must have. It's good for patients, it's good for society, and it's good for our business to have a functioning, healthy community with whom we can partner. So for us, I agree. It's our activities are led by our CSR team and our diversity, equity, and inclusion teams, but it is a company-wide initiative. The expectation is that everybody participates. Everybody is required to have DE&I goals, and then we are held accountable to how we perform against those goals. Everybody is expected, every senior leader is expected to participate in volunteerism and CSR related activities, so that we're not just talking about what matters, but we're really participating and engaged in a meaningful and authentic way. Because you can lead things that you don't know how to do. You can't lead things that you don't understand. And so, from a leadership perspective, it starts at the very, very top with our board and our executive committee and our CEO. And that, as Jenelle mentioned in her experience, really has a big impact. I want to dig a little bit deeper into the importance of kind of listening, which is to me fundamental to any collaboration. I think a lot of times, when a big corporation partners with a community-based organization, like, it's just not an equal. We're not expected to be kind of an equal partnership. One brings money, one brings kind of the emotional connection to and kind of knowledge of the community. We really think that it's critical that we do so in a shared solution kind of way, and that the solutions are measurable and the impact we can really determine, have we really solved the problem? Because too often I think we get into the habit of, there's a problem, we can throw money at a problem, but we don't know whether we've solved the problem. I think in Bobby's introduction, she talked about COVID-19 and how that kind of unmasked a lot of health equity challenges in society. She also mentioned those challenges are not new. Like, COVID-19 didn't create those challenges. It maybe brought some of them to the surface for some parts of our society where they weren't looking for some period of time. But they're big challenges, and lots of organizations, lots of companies, lots of leaders have tried to address those with limited success. And so one of our principles is really thinking about, how do we approach a definable problem, partner to try to solve it, and then measure the impact. And just one example I'd love to share is working with the National Minority Equality Forum Sustainable Healthy Communities organization. About 4 years ago now, we co-created what's affectionately known as the DRIVE Initiative, which stands for Driving Real Improvement, Value, and Equity. And we did so by piloting. The problem that we were trying to solve is the disparity of flu vaccinations among underserved communities. And we started with one community, 3 health systems, and partnered with NMQF and Sustainable Healthy Communities to identify a strong local partner. And working together, we're able to reduce hospitalizations and severe outcomes, things like stroke for people with comorbid conditions, a lot to get out, by increasing flu vaccination rates during flu season by 30%. And so since then, we've kind of grown it incrementally. You talked about the scaffolding, Lauren. These are typically, the successful programs are not ones that you can kind of create on a global or even national scale overnight. And it requires, I think, really thoughtful incremental approach. And one of our key learnings is, I guess 2. One is the importance of the right and strong local partners that we listen to, learn from, and co-create with. And then 2, really making sure that we can measure the impact year over year and scale in a way that allows for that growth to continue. And we've seen that over, in that program that I mentioned, we're, I think, on year 4 now, and each year we've gone into more communities, partnered with more health systems, relied on our, on NMQF to help us identify our local partners, and then together we've seen a sustainable improvement in vaccination rates, which translates into better health outcomes, lower flu incidence, and lower and less severe incidents during flu season. So
those are, I was just going to say, those are great examples, Adam. And before, I know there's just a couple more things I want to sort of get to before our time it winds up. But Jenelle, I wanted to ask a question that has come in that I think would be really interesting for you is, can you speak to the organizational kind of structure, or this enterprise-wide approach that you were talking about, which seems so key and something that people struggle with? Can you say just a little bit more about how the stakeholders inside the organization are being held accountable? What does that actually look like?
Yeah, no, very good question. I think it starts with, our CEO, Rob Davis. This is his expectation, and this is what needs to be in everyone's scorecard. And as they are measuring how they are doing in the year. So, everyone has this, has picked a metric that is appropriate for their function. And that's the importance. I have to say, though, it does for Merck, this is something that's been part of our mission from, where we started. And, that I think draws people like me and others throughout the organization that has that mission impact drive. So it's not something that was too hard to solidify with senior leaders. Your senior leaders get it, but it is very nice to see it, again, part of your just business strategy and how you're thinking. And I know some of that really came true. And, when we pivoted to having to deal with COVID-19 and the pandemic, and how do we as an enterprise come together with many other partners around the world and really make a true impact here.
Got it. That's fascinating. And I know that there's folks would be so interested in hearing even more about that, but maybe we can come back to it. I did want to make sure to have an opportunity for you all to talk a little bit about the Beacon of Hope initiative, because I know you both of your organizations have signed on to that. And I was wondering if you could share a little bit about why and how you decided to do that, and how equity is embedded, as to use your term, Jenelle, or sort of integrated throughout some of that work.
Do you want to kick it off, or you want?
I can. We were thrilled to join the Beacon of Hope initiative, and it really aligns with just our, as I was talking about, our overall mission and goals at Merck. I think we look at this as really taking a multi-pronged approach, and it's integral. And I sort of, gave a little prelude to this, that we start thinking as early as phase 2 or phase 1 of the actual research trials, which, at that point, many of them fail. But what is the plan, and how are we trying to give access? What is the access policies? Who are going to be our partners? And so really thinking about your trial sites, how are you going to educate a diverse population to want to engage in the clinical trials. And so that our, diversity in our trials is not just the initiative, but again, you're kind of hearing the theme. It's baked into how we are even starting the development of our medicines and vaccines, and where are we going to do the manufacturing? Who are we going to partner with then to deliver that medicine or vaccine? So I think, this is an initiative that it's great to be working with Sanofi, Novartis, and others on really looking at this collaboration with other colleges and universities. I think, as Adam has really eloquently said, listening and learning, right? We obviously know this is a journey where we're all trying to improve and get better at, because we need to. And I think this collaboration and this initiative that brings us together so we can really see what works and what's most effective.
And maybe I'll just add a little bit on to Jenelle's comments, and maybe just take, for folks who aren't familiar with the Beacon of Hope, it is a collaboration with historically Black colleges and universities. Huge credit to Novartis for being the first, partner to in this initiative. Like Jenelle, we in Merck, we are super proud to be part of it. And it goes back to something I mentioned before in terms of being really focused on the problem we're trying to solve. And if we acknowledge and recognize, which I think we have, that, the problem we want to solve is health equity, access to care. Jenelle touched on some of them in terms of confidence in the medical system. We have to ask ourselves the questions, not just not just what, do we want to solve those problems, but what's the root cause of those problems? Because if you design solutions that don't get at those root causes, as many have tried before, including us, then we're not going to move the needle. We may make some positive impact, but we're not going to move the needle in a material way, the way we really need to. And so this initiative, like I said, it's a collaboration of a few pharmaceutical companies now, and with historically Black colleges and universities. that's really focused on diversification and diversity of clinical trial participants, clinical trial sites and investigators. So if you're a patient and you walk into a clinical trial site or a medical system, do you see people who look like you that you can relate to and that you have trust with? That starts with, even earlier than that, making sure that we're training medical students and physicians more diversely than we have and are today. And so, the ultimate goal is to make sure that as, companies like Sanofi and Merck and others invest the billions in research to develop these breakthrough medicines to help patients, that patients can ultimately benefit from those medicines. Our goal is to transform the practice of medicine to improve patients' lives. That only works if at the end of the process, Jenelle touched on this in the Ebola example, it only works if that promise of science reaches the patient. And there's a lot that goes into that. And this program is designed to address multiple pieces of multiple barriers of that challenge.
Well, what's really interesting about, so much is interesting, but what I'm particularly, my curiosity is piqued around, this is an example of companies coming together in a sort of pre-competitive basis. And so, I was wondering if you had anything you wanted to share about, maybe it was COVID or maybe it was something else that sort of broken down some of those barriers for collaboration, within the sector. Whereas, you're competitors in many ways, but, finding these areas to address some of these root causes as collaborators rather than competitors. Can you say anything about that?
Well, I think at our core mission, and, obviously we're competitors in one frame, but the other frame, and, I don't think it doesn't make a story because it's not as sexy. We actually do talk a lot and work together a lot, and we have joint missions and impact and trying to get medicines and vaccines out. It is a very collaborative spirit. I'll give one just concrete example. Obviously for Merck, we unfortunately had 2, maybe 3 failures on COVID-19 vaccines. They just didn't work out, but Johnson & Johnson at a point did have a promising vaccine. We manufacture a lot of vaccines, so we have manufacturing plants, and we said, hey, can we help out? We worked together and we started, retrofitting and starting to manufacture a J&J vaccine. And I think those are things as a group of, I'll just say for pharmaceutical companies, that we do work together in areas that there is real unmet medical need, public health initiatives. We know how we can work together, talk to each other, and really put our shoulders behind the most, need. And if someone has something, we want to help it get there. So I think, there is more collaboration than I think gets as much visibility as it should, because I don't think it's as fun of a story. But I think that is at the root of a lot of what we do. And I'm sure Adam has some other examples.
Yeah, no, I want to make sure we have time to get to Q&A. So I'll just say, everything Jenelle said. I think COVID-19 is a great example of where industry really came together, and not just industry, but industry and government, academic, came together as a global community to do what had never been done before in terms of development of safe and effective vaccines and treatments against COVID-19. Like Jenelle, our vaccine was delayed, and we were hopeful. We expect it to still become part of the solution, and particularly as part of a booster solution in some of the, and especially in underserved countries that haven't had the vaccine access yet. But like Merck, we contributed manufacturing to all 3 of the approved COVID vaccines while we were continuing our own R&D. And the other area where I think industry has really stepped up to work together is around the issue of health equity and DE&I. So, we talked about Beacon of Hope a little bit, which has, 3 industry participants in it. The trade association that represents all of the industry also, together with our heads of R&D, is investing significant resources around clinical trials diversity and partnering, again, with academics and local communities to really get at some of the root causes. Like we've talked about, the problem isn't new. We want to make sure that we're not trying the same strategies that have failed in the past to solve what is really not a new problem.
Right.
And so that, I think, is an area that we've really stepped into as an industry.
Well, a couple questions have come in, and I want to sort of sneak at least another one in. And this is a really good one, I think. When considering how far spread or widespread the needs to improve health equity are at local and national levels, how do you pinpoint specific initiatives to focus on within your CSR, ESG, DEI strategies? In other words, how do you look at the whole spectrum or the whole landscape and decide what you, Sanofi, or you, Merck, are going to do?
It's a great question, and I think it's about prioritization, right? And it's not, and that's not to suggest that things that we don't do aren't also priorities or also aren't very important. It's a self-awareness and a recognition that we can't solve every problem. That if we try to get involved everywhere, then we probably won't make the impact anywhere. And so at Sanofi, like I said before, it is a company-wise, I like Jenelle's phrase, an enterprise-wide commitment, but it's led by a couple teams around DE&I and CSR that have identified, where are we going to win? Just as we, on the kind of the commercial side, we don't try to develop and discover a medicine to treat every single disease. We focus on where we believe we have scientific expertise and high unmet needs. And that's our approach in kind of CSR and DE&I as well, where do we have an opportunity to make a disproportionate impact? Where do we have, kind of foundational knowledge that we can bring to bear? And then how do we partner with the right organizations to make progress in a targeted and focused way, so that we can, it's really less is more in some circumstances. I think this is one of them.
Great. Jenelle?
I agree exactly with the themes that Adam just said. I think, one part I'll say, this is also where collaboration across the ecosystem is important. We know what each other are doing, and sometimes not all of us have to be a lead in initiative. We can assist, and that Sanofi may actually have the expertise and they're the ones that should be taking the lead, but we'd love to help out, and vice versa. And so I think, we have the health equity framework, like Adam says, where we have our health equity team, our ESG teams, that is doing that landscape analysis. And, in the past, and what we have really worked hard with, as CDC Foundation has been part of this, is our Merck for Mothers initiative, where we are trying to stem, mortality during childbirth of mothers. And, that is an area that we have really focused on, and that has helped us also develop the expertise within the company, taking that globally, coming up with unique solutions, partnerships globally to try to address that issue. But I strongly agree with Adam. You do need to really look at where your company can make the biggest impact instead of trying to do everything.
Mm-hmm, mm-hmm. Well, thank you. And I, have to thank you for that shout out around sort of Merck for Mothers. As a pediatrician and former public health person, the idea of focusing on maternal mortality and morbidity is huge. So thank you so much for that. I'm going to turn it back over, as much as I am sad to do so, back over to Bobby. It feels like we could talk for a lot longer, but I know Bobby likes to keep these quick moving and really pithy, but it's been a pleasure to be in conversation with you, and judging by some of the questions that came in, I think people were really interested in what you had to say. So thank you so much.
Yes, thank you. And yeah, we had a lot of questions. I'm so sorry we weren't able to get to all of them, but I just want to thank the audience for being so engaged and for asking your questions. And Jenelle and Adam, thanks so much for sharing your insights, your challenges, your stories, and really continued success and progress in your companies and the efforts that you're doing to help increase health access. We really value the work that you're doing. And Lauren, thank you so much for the thoughtful moderating. I know you've done several of these events for the Shared Value Initiative, and you always add to the dialogue with your deep experience and wisdom. So thank you for that. For our audience, I just want to mention a couple of things before we close for today. We have a couple of events upcoming. First, on September 20th at 10 a.m. Eastern, we have a discussion on transformation for innovation and access featuring speakers from Pearson and Abbott. On October 11th at 12 p.m. Eastern, we have a leadership discussion on economic inclusion and the private sector featuring speakers from Truist, Walmart, and 110. Again, I want to thank our incredible speakers, Adam, Jenelle, and Lauren for her excellent moderating. I also want to give a shout out to folks behind the scenes who made this session possible, Gail Gershon, Georgie Eckert, and Emily Mosler. Thank you to all of you, and also thank you to our audience for being here. I hope you found this session as valuable as I did, and we hope to see you at another Shared Value Initiative event real soon. Thank you.
Thank you.
Thanks.